These are photomicrograph images of H&E stained systemic histology slides. Trachea is composed of C-shaped rings of hyaline cartilage with tracheolus muscle, smooth muscle, posteriorly. The lining epithelium as seen here is the pseudo-stratified ciliated columnar epithelium with goblet cells. The layers seen from within outwards is mucosa, submucosa, hyaline cartilage and adventitia. In submucosa we find seromucous tracheal glands. A slide which looks similar to this is the epiglottis. However, in the epiglottis we find elastic cartilage, and two types of lining epithelium seen: stratified squamous and pseudostratified columnar. On scanning the entire slide of lung we can identify the intrapulmonary bronchus with the plates of hyaline cartilage and the lining epithelium of pseudo-stratified ciliated columnar epithelium. The alveoli are lined by flattened squamous cells. There are 6 layers which constitute the cerebral cortex. Superficial layer closest to the pia mater is the molecular layer. Following which we have the external granular, external pyramidal, internal granular, internal pyramidal and the multiform layer. Though it is difficult to clearly differentiate the various layers, we can identify the pyramidal cells by its shape. The size of pyramidal cells keeps increasing as we go deeper from small, medium and large pyramidal cells. Cerebellum can be identified by the presence of the large flask-shaped cells, the Purkinje cells. Focused here is a single folia with the outer gray matter composed of 3 layers: molecular, Purkinje cell layer and granular layer. The white matter consists of myelinated nerve fibers. This slide can be easily identified by the typical appearance of H-shaped gray matter with the central canal. The salient features of cornea is the stratified squamous corneal epithelium beneath which lies the anterior limiting membrane, the Bowman membrane. The next layer seen is the corneal stroma, also known as substantia propria, composed of bundles of collagen fibers and fibroblasts. Beneath this is the posterior limiting membrane, the Descemet membrane, and then the corneal endothelium. The outermost layer of retina is the pigment cells, followed by the layer of rods and cones. There is a wide gap between these 2 layers since the pigment cells get detached during the process of slide preparation. The next layer is the outer nuclear layer, which can be differentiated from the inner nuclear layer since it is thicker. The ganglion cell layer can also be identified by the presence of large cell bodies. The axons of ganglion cells form the optic nerve. In the focused area of kidney, the cortex, can be identified by the presence of the Bowman's capsule with the glomeruli, which appear like a round mass. Surrounding this we find cut sections of the proximal and distal convoluted tubules. The proximal convoluted tubule are numerous and can be identified since it is highly eosinophilic, with small lumen, single layer of cuboidal epithelium and brush border, microvilli. The distal convoluted tubule are fewer in number, have a large lumen, and cells stain lightly. In this slide, the key identification point is the transitional epithelium, also known as urothelium, with the topmost layer of umbrella-shaped cells. The function of urothelium is its ability to stretch and impermeability, acting as a defense mechanism. To differentiate it from urinary bladder, we can see the collapsed lumen of the tubular structure, the ureter. The urinary bladder has a thick muscular wall, with inner longitudinal, middle circular and outer longitudinal layer. Here we also see the same epithelium as ureter, the transitional epithelium. This slide is easily identified by the presence of transverse sections of seminiferous tubules in which we find the spermatogenic cells, in various stages of development, and the supporting cells, the Sertoli cells. In the interstitial connective tissue, we find the Leydig cells which secrete testosterone. Here we see the lumen of the tubules and epididymis filled with sperms, and the lining epithelium of these tubules is the pseudostratified epithelium with stereocilia. The vas deferens can be identified by the small fan-shaped lumen and the thick muscular layer. The lining seen here is pseudostratified columnar epithelium with stereocilia, unlike that of ureter. Here in the slide of prostrate, we can identify the fibromuscular stroma, intervening between the glandular acini. This is one of the features which helps to differentiate this slide from mammary gland and epididymis. The lining seen here is the pseudostratified columnar epithelium, and, occasionally in the lumen we may find prostatic concretions. The three layers of endometrium, myometrium and perimetrium can be clearly seen here. The lining epithelium is simple columnar, and the tubular glands and spiral arteries can be seen in endometrium. Fallopian tube is composed of the mucosa, muscularis and serosa. The lining epithelium here is the ciliated columnar cells and the secretory, PEG cells. In the slide of ovary we can clearly see the outer germinal epithelium composed of cuboidal cells, the cortex and the inner medulla with the connective tissue and blood vessels. In the cortex we see the ovarian follicles in various stages of development, the primordial, primary, secondary and the Graafian follicle. The Graafian follicles has the theca externa and interna surrounding it. The corona radiata cells around the primary oocyte, as well as the prominent zona pellucida, can also be seen. The secretory alveoli with the secretory product, which is the milk, can be seen in this slide of mammary gland. This slide can be confused with prostrate or lung. Soon we will have a look at the ways to differentiate similar looking slides in the next video. comes to the end of systemic histology slides. In the next video you could test yourself and try to identify the slides.